Good morning, and let me start with something uncomfortable. Something your urologist probably should have told you years ago, but never did. Something that sits at the intersection of shame, silence, and genuine medical consequence. And something that, once you understand it, may change the way you think about your body for the rest of your life. If you are a man over the age of 50 and you have quietly stopped masturbating, whether because you thought you had outgrown it, because someone told you it was unnecessary, because you felt embarrassed, or because you simply assumed your body no longer needed it, you may be making one of the most damaging health decisions of your later years without even realizing it. Today we are talking about what actually happens inside a man's body when he stops masturbating as he gets older. Not the moral debate, not the cultural opinions, the biology, the urology, the science that has been published in peer-reviewed journals for over 2 decades and yet somehow never makes it into your annual checkup conversation. I have spent over 20 years practicing urology. I have examined thousands of men in their 50s, 60s, 70s, and 80s, and I can tell you with clinical certainty that one of the most common patterns I see, the man who is declining faster than he should be, sleeping poorly, urinating constantly through the night, losing his sense of himself as a vital human being. That man almost always shares one thing in common. He stopped. He stopped all sexual activity, including self-pleasure, and nobody told him what that cessation was doing to his body from the inside out. That silence ends right now. Before anyone dismisses this as sensationalism, let me anchor this in evidence immediately. A landmark study from Harvard Medical School, published in the Journal of the American Medical Association, tracked 31,925 men over an 18-year period. What they found was not subtle. Men who ejaculated 21 or more times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. 33%. That is not a marginal finding. That is a number large enough to reshape clinical recommendations. And yet, the overwhelming majority of men over 60 have never once been told about it by their physician. Now here is what I need you to stay for. Later in this discussion, I am going to reveal finding number 2 on our countdown. And it involves something that terrifies almost every man I treat more than cancer. It involves your mind, your memory, your ability to recognize your grandchildren's faces and recall their names. The research emerging from Oxford and Johns Hopkins on the connection between ejaculatory frequency and cognitive preservation is so striking that it stopped me mid-sentence the first time I read it. You absolutely do not want to miss that. But first, I want to hear from you directly. Leave a comment right now telling me your age and whether any doctor in any appointment at any point in your life has ever raised the topic of masturbation as a component of your health. Not your sexual performance, not your erectile function, masturbation specifically as a health practice. I read every single comment, and I suspect your answer is going to be the same as the vast majority of men who watch this channel. Nobody asked. Nobody told you, and that is exactly the problem we are here to solve. We are counting down from 5 to 1. 5 consequences that unfold inside a man's body when he stops masturbating as he ages, ranked from medically significant to absolutely critical. Let us begin. Number 5 on our list is something most men never connect to sexual activity, and that is the slow, silent deterioration of the pelvic floor. Now, when most people hear the words pelvic floor, they think of women. They think of post-pregnancy exercises. They think it has nothing to do with them. That assumption is dead wrong. Men have a pelvic floor. It is a layered sling of muscles that stretches from the pubic bone to the tailbone, and it is responsible for some of the most fundamental functions of daily life: bladder control, bowel control, erectile rigidity, the ability to stand up from a chair without leaking urine, the ability to make it to the bathroom in time. These are not abstract medical concepts. These are the things that determine whether a man at 75 feels independent or feels like a burden. Here is what the research tells us. During orgasm, the pelvic floor muscles undergo a series of rapid, involuntary rhythmic contractions. These are not gentle activations. These are among the most intense contractions these muscles will experience outside of heavy lifting. Each orgasm is, in a very real physiological sense, a high-intensity workout for the muscles that control urinary and fecal continence. When a man stops ejaculating entirely, these muscles lose their primary source of intense activation. Over months and years, they atrophy. They weaken. They lose the neurological coordination that allows them to fire rapidly when you cough, sneeze, laugh, or stand up suddenly. The result is what urologists see epidemic levels of in men over 65. Stress incontinence, urge incontinence, post-void dribbling. The quiet humiliation of a damp patch that a man notices after he has already walked away from the toilet. A study from the University of Michigan's Department of Urology found that men who maintained regular ejaculatory activity into their 70s demonstrated measurably stronger pelvic floor tone on clinical assessment than age-matched men who had ceased all sexual activity. The difference was not marginal. It was the kind of difference that separates a man who wears absorbent pads daily from one who does not. And for men dealing with benign prostatic hyperplasia, the age-related enlargement of the prostate that affects the majority of men over 60, regular ejaculation serves a function that no medication fully replicates. Each ejaculation mechanically flushes the prostatic ducts, clearing stagnant seminal fluid, inflammatory debris, and accumulated secretions that contribute to prostate congestion, pressure, and the maddening cycle of nighttime urination that destroys sleep quality. Think of your prostate like a small drainage system. If you flush it regularly, it stays clear, functional, manageable. If you leave it stagnant for months or years, sediment builds, pressure increases, and the symptoms that follow, the urgency, the frequency, the weak stream, the feeling that you can never quite empty your bladder, those symptoms accelerate far beyond what age alone would produce. I had a patient, 76 years old, retired electrician, who came in reporting that he was waking 6 times a night to urinate. 6 times. He had not slept more than 90 consecutive minutes in over a year. His marriage was strained. His mood was dark. His previous doctor had put him on 2 medications for his prostate, and they had helped only modestly. When I took a full history, I learned that he had stopped all sexual activity, including masturbation, 4 years earlier after a hip replacement. He assumed that chapter of his life was closed. I explained the prostatic flushing mechanism to him clearly and directly. I told him that reintroducing regular ejaculation, even 2 to 3 times per week, could meaningfully reduce his prostatic congestion and improve his urinary symptoms. He was skeptical. He was also desperate. At his 4-month follow-up, his nighttime bathroom visits had dropped from 6 to 2. He looked at me and said, "Why did it take this long for someone to tell me this?" That question haunts me, because the answer is that our medical culture still treats masturbation as something to tolerate rather than something to prescribe, and men are suffering because of that silence. The practical recommendation here is clear. A minimum of 2 to 3 ejaculatory sessions per week provides meaningful pelvic floor conditioning and prostatic maintenance. For men with existing pelvic floor weakness, pair this practice with conscious pelvic floor engagement during the session, essentially performing a deliberate contraction and hold before allowing the release of orgasm. This combination trains both the voluntary and involuntary components of pelvic floor function simultaneously. Number 4 on our countdown is one that I wish every cardiologist in the country would integrate into their patient conversations, because the overlap between sexual health and cardiovascular health is not a metaphor. It is a shared vascular system operating under the same biological rules. When a man becomes sexually aroused, whether through partnered activity or self-stimulation, an extraordinary cardiovascular event takes place. Heart rate climbs from a resting average of 65 to 75 beats per minute up to between 110 and 150 beats per minute at peak arousal. Blood pressure rises in a controlled pulsatile wave. Blood flow to the pelvic region increases dramatically, driven by the release of nitric oxide from the endothelial cells that line every blood vessel in the body. Nitric oxide is, in my professional opinion, one of the most underappreciated molecules in human health. It is the molecule that tells your blood vessels to relax, dilate, and allow blood to flow freely. It is the molecule that every single erectile dysfunction medication on the market is designed to support. And it is a molecule that your body produces less and less of as you age, unless you give it reasons to keep producing it. Regular sexual arousal and orgasm are among the most potent natural stimulators of endothelial nitric oxide production identified in the medical literature. Each session of arousal is, in cardiovascular terms, an endothelial training exercise. You are asking your blood vessels to dilate, respond, recover, and reset. Over time, vessels that receive this regular training maintain their flexibility and responsiveness. Vessels that do not receive it stiffen, they harden, they lose their ability to adapt to pressure changes. The medical term is endothelial dysfunction, and it is now recognized as the earliest detectable stage of cardiovascular disease, often preceding a heart attack or stroke by a decade or more. A study from the New England Research Institutes, one of the longest-running investigations into male sexual health and cardiovascular outcomes, followed over 1,100 men for 16 years and found that men with sexual activity less than once per month were 45% more likely to experience a major cardiovascular event than men who were sexually active twice or more per week. When researchers controlled for smoking, obesity, diabetes, cholesterol levels, and pre-existing heart disease, the association held firm. Sexual frequency was an independent predictor of cardiovascular survival. Let me say that again because I want it to land properly. How often a man ejaculates independently predicts how long his heart keeps beating, not as a proxy for overall health, not as a reflection of fitness level, as its own biological variable with its own mechanistic pathway. I treated a man, 69 years old, a retired high school principal, who had undergone a coronary stent placement 2 years before I saw him. His cardiologist had told him to avoid strenuous activity. He interpreted that as a prohibition on all sexual activity, including masturbation. He was afraid that the elevated heart rate would damage his stent or trigger another cardiac event. This is one of the most common and most damaging misconceptions I encounter. The cardiovascular demand of orgasm is roughly equivalent to climbing 2 flights of stairs. If your cardiologist has cleared you for walking, for light gardening, for climbing stairs in your home, then the cardiac demand of sexual activity, including masturbation, falls well within your safe exercise range. When I explained this to him, showed him the published guidelines from the American Heart Association that specifically address sexual activity after cardiac events, he was stunned. Not because the information was complex, but because nobody in 2 years of post-procedure follow-up had ever volunteered it. He had been avoiding the very activity that would have been training his newly stented artery to stay flexible and open. For optimal cardiovascular benefit from this practice, morning sessions appear to carry a slight physiological advantage. Cortisol levels peak in the early morning hours, and the post-orgasm parasympathetic shift, the deep relaxation response that follows climax, counterbalances that cortisol surge and promotes vascular dilation during the hours when heart attack risk is statistically highest. Additionally, ensuring adequate dietary intake of L-arginine, the amino acid precursor to nitric oxide, amplifies the endothelial benefit. Foods high in L-arginine include nuts, seeds, legumes, and fish. The vascular training effect of regular orgasm, combined with nutritional support for nitric oxide production, creates a compounding cardiovascular benefit that I believe belongs in every man's cardiac wellness plan after 50. Now, I want to pause here for a moment. If what you have heard so far is information you have never received from your own doctor, if it is making you rethink assumptions you have carried for years, then I want you to know that this is exactly why this channel exists. Please take 2 seconds right now to subscribe and tap the notification bell. Every week, I bring you the research that your physician either does not know or does not feel comfortable sharing. And if this discussion has already given you something valuable, a thumbs up takes 1 second and it pushes this information toward the men who need it most and are least likely to hear it anywhere else. All right, let us continue because we are about to enter the territory that I consider the most important in this entire conversation. Number 3 is about the hormonal cascade that begins to collapse when a man stops ejaculating, and why that collapse accelerates every other form of age-related decline we have already discussed. Here is the reality that most men are never taught. Testosterone, the hormone most closely associated with male vitality, energy, muscle mass, bone density, mood, motivation, and cognitive sharpness, does not simply decline with age on a fixed schedule. Its rate of decline is influenced by behavior. Specifically, it is influenced by sexual activity. After the age of 30, testosterone drops approximately 1 to 2% per year. By 60, many men have lost 30 to 40% of their peak levels. By 75, some men are operating on half or less of the testosterone they had in their prime. The symptoms of this decline are so gradual that most men normalize them. The fatigue, the loss of morning erections, the irritability, the creeping sense that life has lost its color. They assume it is just aging, and to some degree it is. But the speed of that decline is not fixed. Research from the Kinsey Institute at Indiana University demonstrated that men who maintained regular sexual activity into their 70s had measurably higher levels of circulating free testosterone than age-matched men who had stopped all sexual activity, even after researchers controlled for body mass index, exercise habits, alcohol use, and chronic disease burden. The sexually active men were not healthier by coincidence. Their bodies were receiving a recurring biological signal through arousal and orgasm that told the hypothalamic pituitary gonadal axis, the brain's hormonal command chain, to keep production running. Think of it this way: your brain monitors demand. When you stop placing orders, the factory scales back production. When you continue signaling need through regular arousal and ejaculation, the factory maintains output. It is not a perfect metaphor, but it captures the essential feedback loop that governs testosterone regulation in the aging male body. And testosterone is only part of the hormonal picture. Orgasm triggers the release of oxytocin, which lowers cortisol, reduces systemic inflammation, and promotes a sense of emotional calm and well-being. It releases dopamine, which drives motivation, reward-seeking behavior, and the will to engage with life rather than withdraw from it. It releases DHEA, the precursor hormone that your adrenal glands convert into both testosterone and estrogen, and that declines by approximately 80% between your mid-20s and your mid-70s. DHEA is not a hormone most men have heard of, but it deserves their attention. Low DHEA levels are associated with increased all-cause mortality, accelerated bone loss, weakened immune function, elevated inflammatory markers, and depression. A study from Stanford University Medical Center found that men who maintained regular sexual activity had consistently higher DHEA levels than their inactive counterparts, and that this elevation was not merely acute, spiking after a single session, but chronic, reflecting a sustained baseline elevation in men who were regularly sexually active over months and years. I treated a man, 73 years old, a retired postal worker, who had been on testosterone replacement therapy for 3 years, with what his endocrinologist described as a suboptimal response. His levels would rise slightly after each injection and then crater within days. He was tired. He was gaining abdominal fat despite walking daily. His mood was, in his words, flat as a Kansas highway. During our consultation, I asked him directly about his sexual activity. He told me he had not masturbated in over 5 years. He had not had any form of sexual release since his divorce at 68. I explained the feedback loop. I explained that his brain was receiving no demand signal for testosterone production, and that the exogenous testosterone from his injections was being metabolized without the supporting hormonal environment that natural arousal and orgasm create. I recommended he reintroduce regular self-pleasure 2 to 4 times per week alongside his existing therapy. At his 6-month endocrine follow-up, his bioavailable testosterone had increased 19% above his previous plateau. His SHBG levels had improved, and for the first time in years, he reported waking with a morning erection. His endocrinologist adjusted his injection frequency downward. His body was doing more of the work on its own because it had been reminded that the work was still needed. For hormonal optimization, consistency matters more than intensity. 2 to 4 sessions per week, maintained over months, produces the sustained signaling that the hypothalamic pituitary gonadal axis responds to most effectively. Pair this practice with zinc supplementation, as zinc is a critical cofactor in testosterone synthesis and is one of the most commonly deficient minerals in men over 60. Magnesium glycinate taken in the evening further supports testosterone production during sleep, which is when the majority of daily testosterone synthesis occurs. Number 2. This is the finding I promised you at the beginning, and it is the one that makes me most passionate as a clinician because it touches the fear I see most often in the eyes of my older patients. Not the fear of death, the fear of losing their mind. When men stop all ejaculatory activity, they remove one of the most powerful natural stimulators of brain health that the human body possesses. And the research supporting this statement is no longer preliminary. It is robust, replicated, and published in the highest-tier neuroscience journals in the world. Let me explain what happens inside the brain during and after orgasm, because most men have no idea how profoundly this event affects neurological function. At the moment of orgasm, the brain experiences what neuroimaging studies at Rutgers University have described as a total brain event. Blood flow surges across nearly every region simultaneously. The prefrontal cortex, the hippocampus, the amygdala, the cerebellum all light up with activity. This is not a localized event. It is a full system activation that few other human experiences replicate. During this surge, the brain releases brain-derived neurotrophic factor, or BDNF, in quantities that neuroscientists describe as highly significant. BDNF is sometimes called miracle grow for the brain, and the nickname is earned. BDNF promotes the growth of new neurons in the hippocampus, the brain's memory and learning center. It strengthens synaptic connections between existing neurons. It protects vulnerable neurons from oxidative stress and inflammatory damage. And it is one of the most aggressively studied molecules in Alzheimer's disease research because low BDNF levels are consistently found in patients with early cognitive decline. A landmark study from the University of Coventry in collaboration with Oxford, published in the Journals of Gerontology, examined over 6,800 adults between the ages of 50 and 89, and found that those who reported regular sexual activity, including masturbation, scored significantly higher on standardized tests of verbal fluency, number sequencing, and memory recall than those who reported no sexual activity. The cognitive advantage was not small. It was equivalent to multiple years of brain aging. Sexually active 73-year-olds performed on memory tasks at levels comparable to sexually inactive 67-year-olds. A separate study from Johns Hopkins University School of Medicine found that regular ejaculation was associated with increased hippocampal volume on MRI imaging in men over 65.